better. My name is Adnan Hyder. I'm the Senior Associate Dean for Research and Professor of Global Health here at the George Washington University's Milken Institute School of Public Health, and I take great pleasure in welcoming all of you to our 13th webinar on ethics and COVID. This webinar series is co-sponsored by the Bioethics Interest Group and the Office of Research Excellence here at GW's School of Public Health. I'm so honored and delighted both at the very exciting topic, which is very close to my heart, that of publication ethics, but also at the two wonderful colleagues who have given their time today. And I know it's late evening for them in their respective countries to be with us and provide their reflections. Ladies and gentlemen, since the advent of the COVID-19 pandemic, as you know, the importance of science, the importance of facts and research has been highlighted in multiple ways, not only within scientific circles, but also, as you know, within political circles. And so this notion of getting scientific evidence quickly and appropriately through peer review and analysis and appropriate publication so that scientists around the world, researchers and policymakers can access it is become very, very important. And so today we will focus on publication ethics in the times of COVID. And I'm very excited that we have a very experienced editor and a very experienced bioethicist to discuss these topics. I'm going to first request Dr. Laura Gologli to kickstart her opening comments. Laura is a medical doctor as well as trained in public health. She got her medical training in Belgium and in Oxford in the UK, and her public health training in Australia. But most importantly for us, she is the very well-known editor-in-chief of the journal that many of us like to publish in, the Bulletin of the World Health Organization. The Bulletin of WHO has a special place in many of our hearts because it is still free, it's still open access, and it has a reach across all the member states of WHO and the World Health Organization. So Laura, thank you very much for joining today. I want to welcome you and request you to start us off with your opening comments. And I believe you have slides. So could I request my colleagues to stop sharing their screen and Laura can share her screen and move forward. Over to you, Laura.
Thank you very much, Professor Hyder. I'm just trying to get the screen sharing to actually work. So
we can see your slides, and if you click on your first slide and do the slideshow, I think you'll be good to go.
Yeah, you might be able to see them, but I can't. There we are. Okay. So here we are. So thank you very much for inviting me to present today. I'm going to speak briefly for about 10 minutes about the ethics of publication ethics in a pandemic, focusing on scientific credibility and public trust. I am the editor-in-chief of the Bulletin of the World Health Organization, and I'm glad to hear that it's dear to you. We work really hard to try and keep it open access and keep those abstracts in all 6 languages and really focus on research that's pertinent to all countries in the world and not just the higher income ones. So I'm going to broadly introduce the ethical aspects of publishing, specifically editorial decision-making in a pandemic along 3 lines. The first is delineating the responsibility of various actors. The second is understanding the trade-offs inherent in promoting research while avoiding harm and minimizing risk. And the third is trying to reconcile scientific freedom and its lurching progress with information security and public trust. At this point in the COVID-19 pandemic, the world has about 26,000 papers indexed in PubMed. We have 80,000 preprints and 33 official retractions. Are these too much, or are they not enough? We have learned a tremendous amount about this virus at an unprecedented rate and level of detail. So what are a few retractions? What are the consequences of getting it wrong? We may find that people put faith in ineffective treatments, misjudge their risk of illness and death, harm themselves and their families, do not participate in clinical trials, avoid essential care, all individual decisions that can prolong collective suffering. This is just a summary of the sort of things those 26,000 papers have helped us learn. This is sort of a summary of the preclinical findings relevant to how the virus behaves. And it's really an extraordinary scientific advance in this time. So everything that I want to say about an overload of information should be taken in the context of also extremely valuable information having been produced in this time. Editors are always asking 3 questions. Is it needed? Is it valid? Is it new? That is the information we're receiving pertinent, reliable, novel? And how do we know? Ethics for editors means being constantly critical and constantly open to refutations of received ideas and to the explorations of new ones. Editors need to treat what they receive with impartiality and be able to recognize its limitations, the logical fallacies, the acceptable caveats, the low-value duplications, all the way to grave research misconduct, misreporting, and fraud. And this is what it looks like when you're an editor. You sit there and say, a lot. When we feel ourselves getting overwhelmed with information, instead of asking what's gone wrong with the information, we can ask what filter just broke? What were we relying on before it stopped functioning? And when we start asking that question, we'll get some clue as to where to put the redesign effort. The reason that journals want to apply some sort of quality filter can be hard to understand from an economic perspective, particularly when some journals are charging per paper. But there's definitely an ethical reason that hasty, poorly designed, and shaky studies should be walled off from the people who want to base public policy on them. The engineer really needs to stand under the bridge. This pandemic has shown us that we've moved abruptly from an evolved system in which very few people had access to, the curiosity for, or the ability to comment on raw data and preliminary analyses, to an engineered system of radical exposure to the inner workings of the scientific process. So it's hardly surprising there's been a few bumps. We've pushed formal and explicit statements about uncertainty into people's lives for the first time. As early as last year, the principal guarantor of scientific authority wasn't law or regulation, and it wasn't hardware or software. It was just inconvenience. It was really a hassle to figure it all out if you weren't in that particular field. So the design brief we need now for scientific publishing has to account for the difficulties faced by all the major actors of our system, the patients, their families, but the journalists, the healthcare workers, the policymakers, the systematic reviewers. If we analyze the situation through the concept of filter failure, positing that the main problem is not that there is too much information, but that the traditional means of managing and evaluating information are ill-suited to the realities of the pandemic response. Some of the major instances of filter failure are inadequate information retrieval systems for point-of-care settings and the problem of identifying all relevant evidence in an exceedingly diverse landscape of information resources. And part of the reason the filter broke was a deliberate attempt to speed up the process. This map comes from 2016, and those of you who are avid readers of the bulletin might recognize it. This was as the Ebola epidemic was winding down in West Africa, and Zika was just starting up in Brazil. We tried to look at what had already been known about Zika outbreaks. And both Ebola and Zika have been causing outbreaks for decades. But the very slow accretion of knowledge on these viruses means that we don't have effective means of preventing those outbreaks, and we don't have effective means of treating people. So the push to try and get the data shared more publicly, more quickly, resulted in the International Committee of Medical Journal Editors changing its recommendation on precedence. Henceforth, in a public health emergency of international concern, which Zika qualified for, authors would no longer be penalized for making their work public prior to submission to one of the established journals. So this change, and again, it's very recent, in 2016, made preprints newly acceptable for a much wider field than just physics. And now we see that these are responsible for much of the confusion and the blind alleys pursued by both the public and the press this year. The biggest service we possibly could collectively do for the public is to acknowledge the limitations of preprints and present uncertainty around them. In fact, the name doesn't make sense because there's no printing presses involved. So poses a post, and often these are the final appearance of these papers. So perhaps we should call them sketches, research sketches. And I just want to emphasize that nothing is wrong with a high volume of scientific output per se, but it's the distinctions, it's the choices, and it's the separating the wheat from the chaff, establishing what is needed, valid, new, that clogs up the machine when it's beyond what the actual peer review capacity can handle. And then the retractions start coming. So some papers have simply disappeared from the preprint servers. Others have been officially retracted from high-ranking journals, and editors find themselves in the embarrassing situation of having to explain why such prominent articles need to be so rapidly withdrawn. So I'll just very, very quickly flip through the 33 retractions that Retraction Watch has gathered, and I encourage all of you who are working in graduate education to think about looking seriously at this list of papers and what they represent, and actually studying the impact that they had on the pandemic response. So there's 33 of them currently. So 1, 2, and 3. So what kind of filter were we dealing with before this pandemic came along? With the obvious mistakes that people make aside, how many studies are actually providing original data? And as part of the problem of our filter is that the editors have stopped insisting on novelty. One study showed that out of 1,100 COVID papers, only half were actually presenting any original data, and that this proportion is much lower than it was in previous pandemics, particularly H1N1. So whose responsibility is it to shift the balance from speculation and commentary and to invest in valid data generation and analysis? The research funders, the researchers themselves, the writers, the editors, but the journalists, readers, and subscribers too have a right to insist on really pertinent information in this context. Part of the filter breaking is also an increase in our audience, which is something, frankly, we should celebrate. And in trying to balance accuracy, relevance, transparency, and speed, miscalculations are inevitable. Science has always advanced in fits and starts. However, we now have a situation where everyone is affected at the same time, and the erosion of public trust in science is potentially disastrous. So the European Bank for Reconstruction and Development took the Wellcome Trust's Global Monitor Survey, which looks at people's perceptions of and trust in science and its institutions and its individuals in 160 countries, 70,000 people in 160 countries, and combine that with data on all global epidemics since 1970, and tried to see if they could find an association to people having lived through a government response to a pandemic in their own country and their level of confidence in science and scientists. And they focused their analysis on those who experienced an epidemic outbreak in their country while they were in what's called their impressionable years of 18 to 25. And they found that if they were exposed during those years, their actual confidence and trust in scientists were lower than people who hadn't lived through that at their time. And in particular, these respondents were less confident about the trustworthiness and public spirited of scientists. So it's really important that we understand, although this phenomena is current in this pandemic, it affects people's responses in future ones. And we really need that public trust to ensure that the response measures can work at all. The declining level of trust in scientists is driven by the sample of individuals with little or no science education. And if past epidemics are a guide, the response is not straightforward. So even as we speak here today, WHO is responding to a dozen other health emergencies, including cholera, polio, yellow fever, measles, Rift Valley fever, monkeypox, and plague. All of these, perhaps not on the same scale of people affected, but all need more research on the same questions that we face with COVID: how to prevent, how to identify, how to treat, how to cure. And all interventions to be effective need a minimal degree of public trust in science to improve matters over time. And we're actually seeing matters going backwards now with the Ebola response. It's getting more difficult to do the same interventions in the West DRC population. So while the material costs, here we go to our, what might look like a new filter, and I'd encourage you all to think about your contributions to the part of this. This is what a water filter currently looks like. It has a lot of pieces, and it's not claiming to filter out typhoid. Never worked anyway. So we have this material cost of new papers. The input into this system is frankly negligible compared to how much it costs to do the research. But the intangible costs in terms of people's attention, care, concentration, focus, and just confusion is substantial. And the ethical task facing all of us is to balance both and to try and improve this filter. Efforts to limit the spread of harmful information at the point of publication are very difficult and are probably of limited effectiveness. And from the World Health Organization, our position is always that ethical and institutional review boards need to consider the implications of badly planned or executed research early in the research cycle. However, full open access to research and its results remain in the public interest, and censorship is certainly not a viable option. Full reporting allows for validation or repudiation of research findings, and it facilitates the scientific process by allowing researchers to build upon other findings, and is essential for international collaboration, of course, which is the way that research works. So the potential risks of full and open communication, even when flawed, would be expected to outweigh the benefits only in the rarest circumstances. And I'd just like to finish by echoing a call from the COVID Research Coalition, which calls on editors and those responding to the media to engage with journalists who have the capacity and the intent, and I really stress the intent, to critically evaluate biomedical research evidence and to avoid speculation and exaggeration, thereby supporting measured, balanced, trustworthy science reporting. And that's when we know we'll have a better filter. Thank you very much.
Thank you so much, Dr. Galagli. If you can turn the screen off. Thank you for reminding us about some of the challenges in publications right now. I really liked your differentiation of what are the consequences of getting it wrong, your reminder about what you're calling filter failure. I love that phrase. And also this notion of preprint and the implications of that, and certainly your very strong reminder on the end from the COVID Research Coalition is really important. We'll come back to this. Once again, folks, if you have questions, reflections, use the chat board, and we'll come back to getting back to Dr. Lara with some of your questions. I'm really honored now to welcome our second panelist for today, Professor Kaimanthri Moodley. And I'll request her to start sharing her slides as I talk about her. Is professor in the Department of Medicine and director of the Center for Medical Ethics and Law at Stellenbosch University. Professor Moodley, by the way, is very well known in global bioethics circles. I've had the pleasure of both reading her work and participating in meetings with her. She is a highly rated researcher in the field, but also participating in many global agencies and boards, including the WHO Sage Ebola Working Group, which of course experiences from those are very relevant today. So Dr. Moodley, thank you so much for joining us. Really appreciate and looking forward to your opening reflections.
Good evening, Adnan. Thank you very much for the invitation to join this webinar. I'd like to confirm if you can see my slides.
Yes, we can hear and see your slides. Fantastic.
Fine. So thank you very much. And thank you to Lara for a wonderful introductory talk as well. Now, I know that for most of us, publication represents an important component of the research life cycle. We know that it is integral to the process of dissemination of results to the scientific community, specifically as a contribution to the evidentiary base for clinical care of patients. Hence, a review of this process is critical to ensure both scientific rigor as well as scientific integrity and ethics. Now, in pre-COVID times, we know the usual requirement of any good scientific journal would include approval by a research ethics committee, as well as consent processes, conflict of interest declaration, etc., representing the important ethics aspects of any publication. And so I think we will all agree that publication ethics is central to scientific integrity. Now, okay, so during this coronavirus pandemic, or I think it is now more appropriate to call it a syndemic, given the association with chronic non-communicable diseases and a whole range of other outbreaks, which I will come to a little bit later, and of course incorporating systems thinking in how we look at this pandemic. We know that there has been an incredibly high volume of submissions, and review processes were accelerated, as Lara has already indicated, mainly to ensure rapid dissemination of information to contribute to clinical care. This was a time where clinicians really needed to have information to impact on patient care. Now, Soltani et al. Aptly described this as, and I quote, a hot race to publication. Now, under these circumstances, we know that accuracy and quality of data and publications is at risk. Fortunately, there was considerable post-publication review by global experts, and this raised a number of queries, resulting in retractions. And then, of course, there were more publications about the retractions. So this is an example of one such article looking at about 20 retractions as at the 5th of August 2020. And you can see in the slide the widespread of countries involved, of course, with China leading and the United States closely behind. And the range of articles involved was quite variable, from research articles to case reports, even commentaries that ended up being retracted. Now, the most common reason was error or concern related to results or conclusions that were drawn from the data, followed by concern and errors relating to data itself. Now, this was quite problematic, given that data was such a prominent issue in the two main articles that were retracted from the Lancet and the New England Journal of Medicine. Now, these are prominent international journals, as you all know. So the Lancet article related mostly to hydrochloroquine, and the New England Journal of Medicine related to the use of ACE inhibitors and angiotensin receptor blockers in patients hospitalized with COVID-19. Two incredibly important clinical aspects that we needed to take into account during this pandemic. And it was quite concerning, you know, that, that these particular bits of research that the world was really waiting for were problematic. Now, just to look at the New England Journal of Medicine article on ACE inhibitors and angiotensin receptor blockers, it was a retrospective study, we know, and the researchers obtained their data from international databases, obtained from electronic health records from 169 hospitals in 3 continents. Now, the data offered reassurances that ACE inhibitors and angiotensin receptor blockers were not associated with an increased risk of in-hospital mortality in patients hospitalized with COVID-19. And here, the issue was the quality of the information in the databases. Now, the New England Journal of Medicine subsequently issued an expression of concern, and the authors, unable to verify the data and having had trouble confirming, adequacy of the data, subsequently retracted their publication. And so the question that arose was, how did this pass peer review? And this opens up a huge can of worms in terms of responsibilities of peer reviewers. Now, many of us have reviewed for a whole range of different journals. It's a huge responsibility. It's a time-consuming process. And we wonder, to what extent are we as reviewers to be held responsible when the raw data is not made available to reviewers? So it's unclear whether, reviewers have the responsibility of going through the raw data to establish if that in itself is authentic or not. And, how does one actually navigate this process when the essential problem lies in the database? It may be the case that authors are not even aware of these errors. And of course, one needs to start to think very, very carefully about the review process and the extent of responsibility that reviewers need to take, bearing in mind that ultimate responsibility often lies with the researchers who are involved in data collection, even if they are using specific databases to obtain their information. Now, I referred to the pandemic earlier as a syndemic. Others have referred to it as, colliding pandemics, because a whole host of different issues have arisen. We know that with the death of George Floyd, there was international outrage relating to racism. People spoke about racism and COVID-19 as the world's twin pandemics. And the Black Lives Matter movement gained its greatest traction and greatest momentum during the course of this pandemic. And so while we think about racism at a very broad level, we need to think about it also in terms of publication ethics, editorial boards, authors. And I'd like us to look back at some of the publications that emerged during the Ebola outbreak not so long ago. Now, if you look at some of the publications that arose during this time, you will notice a broad range of international authors and maybe not a single person from the DRC involved in this particular publication. Here's another example from the New England Journal of Medicine, again during Ebola. 3 authors, none of whom is African. And so we need to start looking very clearly at the ethics of authorship as well. So how is it possible that a disease affecting Africans in Africa does not include a single person from the region where the outbreak is actually occurring? And this is an important consideration going forward. So far long before COVID-19, in 2017, there was this particular publication in the American Journal of Bioethics. And the authors here argued on the basis of harm and fairness relating to how bioethicists, especially in the Global South, are excluded from the broader bioethics literature. So my colleague Stuart Rennie and I wrote a commentary in response, and we entitled it the Paywall as metaphor. And in this particular piece, we agreed fully with what had been published by Chattopadhyay et al. Earlier, but we actually took it further to look at the various ways in which authors from the Global South are excluded from the broader bioethics debate, be this because there is no access to a whole range of journals in Africa, or because the paywall in terms of charges, especially for open access online journals, is incredibly prohibitive to authors from all low and middle income countries. So even though some journals offer discounts or waivers to a certain extent, this does not meet the needs of all authors in low and middle income countries, and effectively excludes such authors from international debates on really important issues. Now, more recently, Juliet Nabyongar and colleagues wrote about article processing charges. And this is exactly what we face as African researchers when we have to pay anything from $1,500 to $3,000 simply to ensure that our articles are online open access and therefore accessible to a wide range of researchers in low and middle income countries. And so clearly going forward, this is something we need to consider. So world-renowned author and activist Arundhati Roy has said, nothing could be worse than a return to normality. So we know how the world of publication has been prior to COVID. We know what it has been like during COVID, and we need to ensure that considerable change occurs going forward. So how do we recalibrate for life in a reimagined post-COVID world? As Lara has already alluded to, the concept of trust, I think it's so important given the wide range of retractions we've experienced during COVID-19 that has seriously undermined public trust in science, that we ensure that none of this is repeated going forward. Now, to eliminate all forms of misconduct in research is not possible. That's a utopian world that we know will never exist. But we need to do as much as we can to minimize any type of research misconduct. And of course, to ensure that going forward, we have robust review processes. Now, a number of authors have recently written about innovations in peer review, and we need to start thinking more carefully about how we can do this better. You know, having very rigorous standard operating procedures, checklists, using digital technology to assist in the review process can certainly assist us in going forward. Having said that, a few days ago, we had another retraction, this time about a paper published in 2018. Here, the authors have retracted their paper on the HPV vaccine and preterm birth, where they, in 2018, indicated that the HPV vaccine does not cause preterm birth. They suddenly detected an error in terms of data analysis, blamed it on a junior researcher in their team, and subsequently retracted the article. Here again, an important aspect of clinical medicine that has huge impact in the field of obstetrics. What is also important here is that the authors had failed to declare a conflict of interest at the time of submitting their article for publication and for review. The conflict of interest statement did occur after the time, but that in itself was problematic. And so we can see a whole range of ethical issues that we need to deal with in terms of publication, issues that arose pre-COVID, issues that arose during COVID, and issues that will continue into the future. I look forward to further discussion during the Q&A session, and I thank you for your attention.
Thank you very much, Professor Moodley, for that wonderful review. It follows beautifully from Dr. Galagli's presentation. Thank you for reminding us about the notion of syndemics, the fact that I'm so happy to see that you raised the issue of systemic racism, something that I want to go back to, and its connectivity with trust in the face of all of these publications, retractions, and that dialogue there. So very much appreciate this. So folks, if you have reflections, comments, questions, please use the chat board. My colleagues and I will monitor that, and we will try our level best in the next 18 minutes or so to try and get to our panelists with them. Laura, if I could start with you. I'm really intrigued by a question that talks about the role of publishers in society. What are the responsibilities, so to speak, of publications and editor-in-chiefs like yours from a social perspective? And I say this not just necessarily at this context, but also I think it's been raised with other journals as well. So your thoughts on that would be greatly appreciated.
So I think it's a question of really assuming the obligations that go with this position of responsibility. And those obligations include investigating one's own record, if one is a journal publisher or a monograph publisher, what has actually happened with the information that you've published over time, and where have the negative, possibly unforeseen impacts been, and using that continual sort of assessment and reflection to adapt the commissioning strategy going forward. So if we take a really sort of pop culture example, Vanity Fair and all the publications owned by Condé Nast were extremely criticized during the Black Lives Matter movement for being extremely hostile work environments and not really using the contribution of the great diversity of staff that they potentially had at their disposal. So that's a terrible hard shock, and I would hate that for any medical journal to be in that position. But I suspect if we look carefully at our editorial boards and the composition of our authors and the geographical location of our studies and who's been involved in them and where their funding's coming from, none of us are exempt from criticism. So it's important that we're honest enough to do that and keep course correcting going forward. And that commissioning power, the power to determine what's going to be sort of drawn out that's latent because you've identified it as an issue or an area of work that needs more exposure, I think is really important to do that explicitly and very consciously.
No, thank you very much. And, you know, the same is true for the academy, which I represent, right? What do universities owe to society? And we can continue that conversation. But something here, Kimantri, really is important for us. There's a concern between quality and speed. You know, as those who submit articles to journals, we want it published tomorrow. And yet we want to make sure. So how do you think we should negotiate this challenge?
Well, that's what preprints were supposed to solve.
Yes. And so clearly one needs to try to get that balance right, and it's not easy. It's really difficult to get high quality reviewers, especially in the midst of a pandemic. I mean, everybody has been busy. And then to place a timeline, you know, I've had review requests of, can you respond within 5 days? Can you, and it's really difficult. At the same time, I think that during pre-COVID times, some journals take an inordinate amount of time for the review process, which is completely unreasonable. To have to wait a whole year to get a piece published, I think is really unreasonable. And certainly we have waited with international journals for that length of time. So I think what we did see during COVID was that a large number of articles were processed rather quickly, and there were no problems with them. We did have the occasional problems that were detected, resulting in retractions. But I think to a very large extent, it's researcher responsibility. I mean, if we as researchers ensure integrity in our work, it's going to make the entire process easier for everybody. It will speed up. So we have to be the ones to ensure quality when we submit. And then we can be assured of a quicker review process, I'm sure. But having said this, it's difficult. I mean, people talk about, should reviewers be paid to review articles? You know, will that ensure a higher quality type of review or not? And then there are, all the ethical issues. So at most, I know I have been offered a reduction on the submission fee for my next article if I do a review. So that's been, and that's quite useful, because provided you're going to submit to that journal in the future. But having a reduction from a low middle income country perspective on the APC is really, really helpful.
I have you, Kimantri, could you also comment on the role of IRBs here? Do you think the IRBs have a role in, quote unquote, the scientific monitoring here? And then I'm going to also pose the same question to Laura as well.
Yeah, we've had this debate in South Africa recently because we've had 2 articles in the last year involving the use of race as a variable in research. And here the articles were submitted, the research was approved by a research ethics committee, but they have no control over what gets published by the researcher and what goes into the journal. So research ethics committees only see the publication after the time. So at this point, they really don't have a role to play in terms of the publication process. And as we know, research ethics committees, IRBs, are considerably overworked. So exactly. To have also take responsibility for publication would be regarded as unreasonable, I think.
No, and there are concerns, like you said, about mission creep as well. Lara, do you have perspectives on this particular point? And then if you could comment as well on something I'm sure you're asked about, not for your journal, but in general, this notion of fees. And fees is a barrier for our, particularly, it's not just LMICs, but even students, even in high-income countries, are finding that an issue.
So first on the research ethics committees, and even if they don't see the final paper before it's submitted, we should never underestimate the ability of a research ethics committee to influence for the better the methods, the study design, the appropriateness of the population sample, all sorts of things about the research study that are impossible to do later. So I really think we've got a lot of work to do in empowering research ethics committees to really take on more of that, sort of trying to envision what the output and the outcomes of this research will be, and ensure that the design is really done for that, in that end. And then the second question on fees for authors, yeah, it just seems highly unfair, doesn't it? I mean, the people, it's one of these things where the benefits are accumulated by those who need them least. So the people who have nice big funding agencies behind them who will agree also to pay for open access charges, they're doubly sort of blessed. Whereas those that are struggling for funding for their research are also struggling then for funds for publications. So we need to do better on this, and we need to set up either a special fund or a more equitable waiver system that's globally applicable, that you don't have to try again each time a journal rejects you. Or you can all do what the Bulletin of the World Health Organization does and not charge any fees at all, and sort of run along at a, sort of very, moderate level, basically. But yeah, I think definitely as a community and using this experience, we need to do better.
I think that increasingly we are seeing that. I mean, the whole Biomed Central Enterprise and this notion of having fee structures for different groups, I think makes sense, but unfortunately imposes a huge barrier, and that should not be the case. So Kimantri, you raised the issue of trust, and one of our colleagues in the room is a real life physician working in a community here in New York and has concerns about lack of trust, because as you also pointed out, it flows from one topic to the other, right? So if I don't trust the scientist in one issue like COVID, I won't trust them on the flu vaccine either. So any thoughts about that, how to study that, how to help in that process?
So I think when we think about publications in scientific journals, we are disseminating results to the scientific academic community. But we often forget that we need to also be disseminating our findings to communities in lay publications, in lay language that they can understand better. And that community engagement is an important concept to build trust. So not only disseminating our findings after the time, but actually starting the process from the time you develop your research question, because it's really important to get input into what communities think are important health problems in their environment. You know, they may not be able to articulate a research question in the scientific language that we use, but they certainly are able to identify what health risks they have as communities. And so starting the research process by going to the people first, you know, the slogan, not about us, without us, I think that's really important. And so building trust in a way and having authentic community engagement that goes beyond just ticking a box to say, yes, my study has a CAB, you know, the thing that everybody does just to tick the box. So it's about that type of community engagement. Having said that, during a pandemic, it can be incredibly difficult to engage with communities at the same level because of, you know, everybody not having access to digital technology and not having that face-to-face time with community members. So that can be difficult. But building trust in society in general is incredibly important. As scientists, we also need to write more for you know, the media in terms of newspapers. We spend a lot of our effort in writing up these wonderful articles for scientific journals, yet it takes so much less time to write up a nice piece in simple language for the newspapers, so that civil society is you know, engaged in science and research, and they themselves then will start to trust us more. As things stand, I think that we're very low in terms of our bank balance when it comes to trust, especially after what has happened in the pandemic.
Yeah, I think I agree with you, Kamantri, but here's the challenge, and I want Lara, you to tell us. You know, we are now dealing with the complexity of science and politics being intertwined. Some people say it's always been intertwined, but it's now being acutely revealed. And I am speaking from a country that unfortunately is demonstrating, let's just say that myth and fiction and fact is all being clouded. So what, as editors of eminent scientific journals, what are your roles? How can we ensure that fact is considered fact and you know, myth and fiction isn't intertwined? It's a tough conversation to have.
Yeah, and we can't have it with everyone at the same time. That's the difficulty. So we work really hard, not so much on the journal side because we're very well established and have our, you know, we're not the New England Journal, so we don't have the same sort of flashiness. But certainly with the journalists that come to the multi times a week press briefing of that WHO has, we have a lot of misconceptions, misquotations, things that are taken out of context, trying to work with the journalists afterwards to say, look, that wasn't the way that was presented. It's been taken out of context. Please, you know, refer to this material or that material. And it's an ongoing educational process between the people amplifying the message, because as journal editors, usually you don't have a massive audience at your disposal. You work through these amplifiers, and the amplifiers over time are really keen to learn how to do their job better, basically, and to learn to become more numerate about science. And there used to be a fabulous course funded by the NIH. Unfortunately, under the current administration in the US, the funding was taken away, but it was a fabulous course taught at Dartmouth called Medicine in the Media, and it taught journalists basically health literacy and health numeracy. And it really improved the quality of the coverage and the cohort of journalists that were able to attend that course. And I hope that we'll be able to bring something back like that at scale in different languages, and not requiring you to have to go to Dartmouth to study it, through the WHO Health Academy, which will be based in Lyon and which essentially will be virtual and in all languages. So I think that would be a start. But it's a slow, ongoing process of developing that community, your community of amplifiers. Yeah.
No,
Adnan,
yes, please go ahead, Kamantri.
May I just jump in there? And I just want to say that I listened to the WHO press briefing on the antigen test that they've made available, they're making available 120 million doses at $5 a dose to low middle income countries. And it just wasn't clear enough. So it's about science communication, even at the level of the WHO. I mean, I sat and listened, and I could see from the questions that the journalists were posing is they didn't realize that the antigen test was so different from the antibody test. And that wasn't made clear enough. Then they spoke about it as being a pregnancy test. So when you start talking about like a pregnancy test, do you put some urine onto the testing thing? So what bodily fluid goes into this test? Simple things like that were never discussed in the press briefing. And so how we communicate science to the lay public and to journalists in particular is also really important.
Yeah, and I think that what's really challenging currently for example, in this country, is that the very institutions that often produce scientific, unbiased facts, as is being put on the chat board, are being questioned or are now less trusted. And therefore, the advice that they give to the community and the public, be it the Centers for Disease Control, Health and Human Services, NIH, I mean, they're struggling to keep up their scientific bias. And indeed, it is incredibly important right now, particularly as the pandemic has crossed 1 million deaths and over 200,000 here in the US, that the scientific committee not remain on the sideline. I mean, colleagues like Richard Horton and others have been suggesting that for some time, but I think there is a movement afoot here where I think the whole notion of our publications and the implications of those publications will need to be questioned if people like Dr. Manning, who are working every day in the community, are going to be supported. Which brings me to maybe a final question to each one of you. I mean, for you, Lara, I really would like to know from your perspective in terms of the activism as an editor, where do you draw the line between being an activist? It's like asking a judge, right? How much of your own philosophy do you bring in versus, stick to, love to hear your perspectives and any other final comment that you'd like to make.
Yeah, so I suppose there's a spectrum of activism in medical journalism. And my dear boss, ex-boss Richard Horton is on one end of the spectrum, and some colleagues at other journals whom you'll never see are at others. But it doesn't mean that as much backstage work goes on, regardless of the person, out there on the stage and gathering attention. There's just as much serious work going on backstage. And I think that obviously if you want to be an activist, you wouldn't be working for WHO, you would be working for a non-governmental organization where you would probably have more freedom and less political constraints. But all I want to say is that those political strengths are a strength over time, because governments come and governments go, but the public health issues remain the same. We're still battling plague, cholera, things that have been with us for centuries. So, we need to do better regardless of, we can be enabled obviously by a favorable political climate, but we need to do better regardless. And that's, I think, the challenge for scientists lies. Thank you.
And Laura, just to add to yours, I mean, those of us in the academy need to be activists as well. And when the US government decided to pull out of WHO, some of us, including myself, have openly written against that decision and how awful that is for our country. So Kemantri, just, any final thoughts, but particularly from a LMIC perspective, you have made it very clear that engagement and interaction and being on the table is so important. So tell us a final comment from that perspective.
So Adnan, I'm really passionate about this because I know what it feels like as a LMIC researcher to submit an article to a so-called international journal where there is only an interest in publishing research from the global north. So as an LMIC person, it is incredibly difficult to get into an international journal. So an international journal, if it wants to call itself that, needs to engage with an international audience in terms of authorship. I think editorial boards across the board need to be reviewed because a study on 12 global health journals, editorial boards recently showed that only about 35% of editorial board members are women. Only 33% are from LMICs. And of course, to get a woman who's from an LMIC on an editorial board, that occurs only 11% of the time. So I think there is gross underrepresentation on editorial boards. Journals need to look at specific topics that are being submitted and need to ask the question, why is there no author from the region in this particular study? And I think if we start being more sensitive to that, we will see diversity in authorship, which is incredibly important, and will actually improve the quality of the type of papers that we see published. So yes, definitely, and of course the article processing charges are a huge barrier, and we need to address that as well. There's a more, but I'm going to stop at that point.
No, thank you very much. I think both of you have raised critical issues. And I identify in a different way with your last point, Kamantri, as somebody from South Asia, but now in here, those of us, we view ourselves with the lens of intersectionality, that we have multiple identities. And I think recognizing diversity fundamentally brings value. It's not just to do a tick mark that, yes, I have somebody from an LMIC, but it's actually to be respectful and to truly to have great partnership. Ladies and gentlemen, what we have done today is barely scratched the surface of a topic that is near and dear to many of us, which is the ethics around publication, particularly at this time of COVID-19. And not only do I want to thank both of our panelists, Dr. Lara Glogli from the Bulletin of the World Health Organization and Professor Kamantri Moodley from Stellenbosch University, but also thank them for a very frank and honest discussion of this topic. I know that many of you have been conversing on the chat board. I've tried to come across, at least put a few of your comments to our panelists today, but I hope that the conversation can continue. Let's talk about these issues in our own circles, on Twitter, on social media, and make sure that these things that are so close to our hearts are not forgotten, because at the end of the day, they're important for public health, they're important for bioethics as well. Thank you very much for joining us. Please remember, 2 weeks from now, next Tuesday, on October the 13th, we will have our next bioethics webinar. Watch out for the dates, watch out for the topics, and we will be in touch. Thank you very much. Stay safe, stay healthy. Thank you again to both my panelists for joining us today. Bye-bye.